After then, let's see that is the bursa present around that the knee joint. So as you know, bursa, these are the fluid filled cavity which is present around any joint, and the main function of the bursa, that is the shock absorbent and prevent the injury during any trauma. So in relation with that the knee joint, there are 12 bursas are present. So 4 bursas, out of these 4 bursas, they are present anterior side. Then the 4 bursas, they are present on the lateral side in this region, and the 4 bursas, they are present on the medial side. So the anterior bursa. So first, that is the subcutaneous pre-patellar bursa, so which is present into this region. Then the subcutaneous infrapatellar bursa, so that is present in this region. Then the deep infrapatellar bursa, so here you can see deep infrapatellar bursa, this one, and the suprapatellar bursa, that is the largest bursa, that is the suprapatellar bursa. Same bursa which is present on the lateral side, these are the 4 bursas are present, and on the medial side again, that is the 4 bursas are present. So here in this diagram you can see that is the 4 anterior bursa, that is the violet color you can see, that is the subcutaneous prepatellar bursa, then the subcutaneous infrapatellar bursa, then that is the suprapatellar bursa, and this is the deep infrapatellar bursa. Then the lateral side, on the lateral side here you can see that is the 4 bursas. First bursa under the bicep tendon, here that is the bicep femoris muscle is present. Second bursa under, that is the fibular collateral ligament, so this one. Then the third bursa, that is the bursa under, that is the popliteus, and the fourth, that is the bursa, and the fourth bursa which is present deep to that the lateral head of the gastrocnemius muscle. Then on the medial side here you can see that is the 4 bursas are present. So first bursa, that is the deep to the medial head of the gastrocnemius muscle, so here. Then second one, that is the anserine bursa, so here you can see that is the deep anserine bursa. Third one, that is the bursa of the semi-membranous muscle, so here this is. And the last one bursa which is present deep to that the tibial collateral ligament, so here you can see that is the tibial collateral ligament, this green color band, and here deeply to it, that is the 4th bursa is present on the medial side. After then, let's see that is the relations of the knee joint. So first, anterior relation, so here, so anterior relation that include, that is the anterior bursa which consists of the pre-patellar bursa, this one. Then the ligamentum patelli, so this one green color you can see ligamentum patelli, and the patellar plexus of the nerves which is present into this region. Then that is the posterior relations, so here you can see the posterior relation. The posterior relations that should be divided into that the middle relation, the posterolateral relation, and the posteromedial relation. Here you can see the posterolateral relation, here you can see the posteromedial relation. So first see that is the middle relation. So middle relation that include the popliteal vessel, so here you can see this is the popliteal vessel, and that is the tibial nerve, this one. Then posterolaterally, so here that consists of the head of the gastrocnemius muscle, then second one that is the plantaris muscle, then the third one that is the common peroneal nerve, and fourth one that is the bicep femoris or the tendon of the bicep femoris. Then posteromedially, so here you can see that is the posteromedially, that is the medial head of the gastrocnemius muscle, then the semi-tendinous muscle and the semi-membranous muscle, then the gracialis muscle. So these are the posteromedial relation. Then medial relations means on the medial side. the medial relation that include here the sartorius muscle, the gracialis muscle, then that is the saphenous vein and the saphenous nerve. So here you can see. So these are the relations. Then laterally, here that is the laterally the relations consist of the bicep femoris muscle and that is the popliteus muscle. So here that is the popliteus muscle. These two are the lateral relation of the knee joint. Then the blood supply of the knee joint. So the knee joint that is supplied by the anastomosis which is present around that the knee joint, and the main source of the blood supply to that the knee joint, that is the genicular branches of the popliteal artery. So here this one. Then the genicular branch of the femoral artery, then the descending branch of the lateral circumflex artery, then the branches of anterior tibial artery, and the fibular branch of the posterior tibial artery. So these arteries, they are supply oxygenated blood to that the knee joint. The nerve supply to that the knee joint. So there are mainly three nerves which is supplied to that the knee joint. First is the femoral nerve, second is the tibial and the common peroneal nerve. So here you can see that is the tibial nerve, and here that is the common peroneal nerve, and third one that is the obturator nerve. So these nerves, four nerves, they are supply the sensation to that the knee joint. So that is the nerve supply. Then the movements of the knee joint. So there are four movements of the knee joint that should be occur. First, that is the flexion, then second one extension, third one medial rotation, and fourth one lateral rotation. You can see that is the flexion moment of the knee joint, and that is the extension moment of the knee joint. So the flexion and the extension moment, that is the main or the active moment of the knee joint, and the medial rotation and the lateral rotation, these are the conjoint moment of the knee joint. So let's see that is the clinical or the applied point related with that the knee joint. First clinical point, that is the osteoarthritis. So here you can see that is the normal joint, knee joint, and this is the osteoarthritis, where that is the damaging of that the different part of that the knee joint that should be occur. So as you know that is the knee joint, it is the weight bearing joint, and it is because of this the knee joint, it is commonly involved the osteoarthritis. Osteoarthritis means that is the degenerative wear and tear of the articular cartilages. The movement may be painful, limited, and produce grating, and the radiograph of the knee region that reveals the osteophytes, that means the peripheral lipping of the articular end, here on that the medial side and here on the lateral side. So that is the stiffening of the moment of the knee joint, pain that should be occur, pain and the swelling. So that is called the osteoarthritis. Next point, that is the deformability of the knee joint. So in this, the angle between that is the long axis of the thigh and the leg may be abnormal. So generally into the genu valgum, that is the leg, it should be abducted in this way, and into that the genu vagum, or that is called the genu varum. In this, that is the leg should be medially adducted. So these are mostly the congenital abnormality, that is the genu valgum. So this one here, that is the legs are abducted, and into the genu varum, here that is the legs are adducted on the medial side. Then the next clinical point, that is the injury to that the cruciate ligament. So here you can see that is the anterior cruciate ligament, and here that is the posterior cruciate ligament. So the anterior cruciate ligament, it is more commonly damaged than the posterior cruciate ligament. So the anterior cruciate ligament, so this one is injured in the anterior dislocation of the tibia, means the hyper extension of the leg, where that is the posterior cruciate ligament, it is injured in the posterior dislocation of the tibia, means that is the hyperflexion of the tibia. And tear of the cruciate ligament leads to abnormal antero-posterior mobility. The anterior cruciate ligament, it is torn, the tibia is pulled excessively forward on the femur, and posterior cruciate ligament, if it is torn, then the tibia pulled excessively backward side. Then the next point, that is the aspiration from that the knee joint. So whenever that is the collection of the fluid are occur into that the knee joint, so it gives rise swelling above and that is the sides of that the patella. So in such cases, that is the tapping of the fluid or the aspiration of that the fluid from this knee joint, that should be occur, and it should be occur on the either side of that the ligamentum patella, either on the right side or on the left side, or the medial side or the lateral side of the ligamentum patelli. But the joint usually approach from that is the lateral side of that is the knee joint. So that for this the 3 points that should be marked, that is the tibial tuberosity, here that should be present the tibial tuberosity, then that is the lateral epicondyle of the femur, so here, and third one, that is the apex of the patella, so here. So from this region, that is mostly needle should be inserted into that the knee joint, and the fluid tapping should be done, or the aspiration of the fluid should be done throughout that the knee joint. Then injuries to that the meniscus. So here you know that is the medial meniscus is present, and here that is the lateral meniscus is present. So strain occurs due to that the flexion of the knee or the kicking of the football, that is the meniscus may be separated from that is the capsule, and it may be torn, the bucket handle tear, or that is the transversely torn of that the meniscus. So that is the medial meniscus, it is more vulnerable to that the injury than the lateral meniscus, because that is the medial meniscus is more fixed to that the tibial collateral ligament, and because of the greater exertion during that the rotatory moment, the lateral meniscus, this one, it should be protected by the popliteus muscle, and medial meniscus, it is more commonly injured. Then injuries to that the collateral ligament. You know, on the medial side the medial collateral ligament is present, and on the lateral side that is the lateral collateral ligament is present. So injury to that the collateral ligament, it is less common, and it is produced by the severe abduction and the adduction of the strength. So here in this first diagram you can see that is the rupture of the medial collateral ligament, and into that the second diagram you can see that is the rupture of the lateral collateral ligament. So this one. Next to it, the clinical point, that is the house-made bursa or the house-made knee. So it should be occurs due to inflammation into or the friction of the pre-patellar bursa with that the patella, that is during the scrubbing of the floor by the maid into that the house, continuously friction of the pre-patellar bursa with that the patella should be occurs, and because of the inflammation and the swelling should be occurs into that the anterior part of the knee joints, means into that the pre-patellar bursa. So that is called the house-made knee. Then next to it, that is the clergyman's knee. So in this, the inflammation of the subcutaneous infrapatellar bursa or the bursitis that should be occurs, and in this it is occurs due to the friction of the bursa against the tibial tuberosity due to the kneeling. Kneeling means during the prayer of the Christian or the clergyman or the rafers and the floor tillers. So continuously friction should be occurs into that the bursa and the tibial tuberosity, and it should be occurs the inflammation and the swelling into that the bursa. So that is called the clergyman's knee. So last clinical point related with that the knee joint, that is the Baker cyst. So it is the chronic inflammation of the bursa deep to that the semi-membranous muscle, and it may be occurs the cystic swelling into that the medial part of that the popliteal fossa. So that is called the Baker cyst. So these are the clinical points related with that the knee joint.